Good morning, everyone, and welcome to our webinar this morning. There is a lot of information and it is being put out there fast and furiously, and we have two of our experts, I will say, that are really tracking this down. So without further ado, I'm going to give you a couple of quick points about the webinar, and then I'm going to turn it over to our speakers. You all attendees are not able to use the microphone function. However, there is a question little bubble. So please, if you have questions, feel free to send them during the presentation. And when the presentation has concluded, I'll be coming back on. You'll see me, you'll hear me once again to help moderate those questions. So without further ado, there is also a 20-second delay, so please keep that in mind as well. So again, good morning. My name is Gina Stewart. I'm the Executive Director of the BWI Business Partnership. We're so glad you're joining us this morning. And we have Amy Polifrone, CEO and founder of the HR Strategy Group, along with her great associate, Donna Miracle, this morning to get right into the presentation. So I'm going to turn off my webcam and mic for the moment, and we'll be back with you after the presentation to forward your questions. Thank you, and get your pen and paper ready. Thank you.
Thank you, Gina. Good morning, everyone. It is great to be with you this morning and talking about, as Gina said, the fast and furious amount of legislation that in business we are working hard to keep up with. My name is Amy Polifrone, and I am joined by my colleague Donna Miracle, and we do have another of our colleagues, Louise Gusson, one of our subject matter experts, is on the line with us as well. A legal disclaimer about this presentation this morning. This presentation has been prepared by HR Strategy Group for information purposes only. The material discussed during this webinar should not be construed as legal advice or opinion on any specific facts or circumstances in your company. The content is designed for general information purposes only, and especially because this is a fast-moving and enormous amount of legislation that we're tracking, we do urge you to consult an attorney or an accountant concerning your own situation and any specific legal or financial questions that you may have as it pertains to your business. Also, this presentation is a Maryland-specific, Maryland-centric presentation. HR Strategy Group, we are here in Maryland and we serve Maryland clients primarily. So we have that Maryland focus in the information that we are sharing. So what we will be covering this morning is providing you with an overview of important state and federal legislation to assist businesses in the wake of the COVID-19 crisis. We're not going to be getting into what is the virus and all of that. This is very government affairs oriented, and we'll deal specifically with Maryland unemployment, the CARES Act, and the Families First Coronavirus Response Act, FFCRA. So the CARES Act and the FFCRA, these are recent pieces of federal legislation that have been enacted into law and go into effect tomorrow, April 1st. No fooling. So we want to make sure that you have the information that we are familiar with and how it can help you and your business and your employees to stay working and to try and stay as close to whole as possible and minimizing the damage that the coronavirus is having on our economy. So the current federal legislation, the federal government has three major acts to assist businesses to deal with this pandemic. The first is the Coronavirus Preparedness and Response Supplemental Appropriations Act. That was signed into law on March 6th, seemingly a lifetime ago. And where we are today, we have now the Families First Coronavirus Act, FFCRA, and that was signed into law March 18th. Most recently, It was late last week, the Coronavirus Aid, Relief, and Economic Security Act, or CARES, was signed into law March 27th, and goes into effect tomorrow. Some of the provisions of both FFCRA and the CARES Act, some of them are now retroactive. I cannot emphasize enough the fast pace of change of these laws. Donna and I did a series of webinars last week about FFCRA, and already we're finding that the guidance and the regulations are changing and have changed in regards to some of the specifics. Are they major changes? Yes and no. Some of them, it's the retroactive nature of some of the laws and the number of employees covered, but just know, again, this is so fast moving, so you really need to, in addition to this general information, talking with your professional advisors about how this will impact your business. I'm providing down here a link from the U.S. Chamber of Commerce, and they have a really great overview of these three pieces of legislation. Today, we're going to be just focusing on the CARES Act and FFCRA. We're not going to be covering the Coronavirus Preparedness Act, okay? And so, with that, now I want to back up and talk just a minute about Maryland, because there's so many businesses are talking about Maryland unemployment and how this can help their employees in their businesses, and helping companies decide, should we lay off employees, furlough them? What is the difference between layoffs and furloughs? So what we want to share with you this morning is that your employees can apply for unemployment. That first line should be unemployment now. And what would be qualifying events for unemployment is that reductions in work schedules or pay are qualifying events for employees to file for unemployment. And we'll be talking a little bit later this morning, what I've highlighted here, the federal eligibility for an expansion of unemployment benefits expands the unemployment events and the payment amount that employees can receive. Between the federal and the state government, they are trying as much as possible to minimize the economic impact on your employees that are directly impacted, again, by work schedules or by pay. Some companies and organizations are saying, we can keep our doors open for business, but we have to go to 4 days a week of work, or maybe 3 days on, 4 days off. So any kind of, if you're reducing employees' hours, or you're saying we have to work full-time, but we have to reduce pay, either one of those, minimizing the economic impact for employees, are qualifying events. Maryland does not have any waiting period, so the sooner that impacted employees apply for unemployment, the better for them. There is no waiting period in Maryland. There's no minimum number of hours a week that an employee must work in order to receive unemployment. So what's important and crucial is that all employees are eligible to apply for unemployment if their job is reduced, eliminated, laid off, and both your salaried and hourly employees, exempt and non-exempt employees, are eligible to apply. What's very important as employers to understand is that please do not guarantee employees that they will automatically receive unemployment, but you should absolutely encourage them to apply. There are some salary limits, and so it's just, you do not want to be in a position of guaranteeing the unemployment benefits, but you should absolutely encourage them to apply for them, for these benefits. We've had many of our clients and colleagues asking us about how is this Maryland unemployment going to impact the employer rates for unemployment. The state of Maryland has told us repeatedly that employer rates for unemployment are not going to go up due to the coronavirus, the COVID-19 pandemic, and to these related conditions. So employers can retain the employees while an employee can still collect unemployment benefits, and if that helps you to reduce payroll costs. There is a program in Maryland. It's quite new. It's called a work sharing program. And again, it's where if you needed to reduce an employee's hours in your company or organization, that they can still collect unemployment. And we have the link here. Kate, will these slides be sent to the participants?
They can be, yes.
Okay, we're absolutely happy to have all of the slides shared so you don't have to write down every single link. So please know that, it's fine with us. So if we don't, Kate, if you wouldn't mind sending these to the participants, that would be great. That way you will have all of these links, knowing that information does change. But this is going on the current information that we have right now. We've provided a link about frequently asked questions dealing with Maryland unemployment, and Maryland has developed a specific FAQ sheet regarding unemployment in the face of the COVID-19 crisis. So there's that information, and that's where it is referenced that your employer rates are not going to go up as a result of COVID-19. You as employers, you are encouraged and asked to share with impacted employees, encouraging them to apply. And there's the link that is the employee resource section of Maryland unemployment. So now we are going to move on and talk about, our slides move here. There we go. Now we're going to talk about the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act. I'm going to first provide an overview of the CARES Act, and then we're going to do when I say a mini dive, it's just that this again, it's so comprehensive and it's such a massive piece of legislation. We just want to arm you with information so that you know where to turn for resources. So what we have listed for you here are the highlights of the CARES Act. The first is that it has amended the paid sick leave requirements under the FFCRA for rehired employees. Donna is going to take us, be our tour guide for FFCRA a little bit later in the presentation. I'll be focusing my time this morning on highlights 2, 3, 4, and I misnumbered. Oh well, so 2, 3, 4, and 5. So the second highlight of the act is the refundable tax credit for what's called qualified wages. And there's a lot of complexity here, but there are some tax credits that employers can automatically apply for. The third highlight is the deferral of payment of the employer's portion of the Social Security tax. The fourth highlight is the Small Business Administration has provided 4 different types of loans and grants. The first is called the Paycheck Protection Program. The second loan is the Economic Injury Disaster Loans and Grants Program. Third is mid-sized companies and nonprofits assistance. This is for the larger organizations of 500 or more employees. And then lastly, there's assistance for state and local governments and some special businesses. And we'll get into what are these special businesses. And then lastly, there are enhanced unemployment compensation benefits available to employees. It extends the duration and the amount of unemployment for which employees are eligible. The CARES Act is federal legislation, and the federal government is trying very hard to work with the state governments, providing additional financial incentives for unemployment, as well as direct financial and economic assistance to businesses to, again, minimize the economic impact and to keep business open and keep your doors open. So what you have here on your screen is a highlight of the refundable tax credit for qualified wages. So the eligibility for the refundable tax credit for these qualified wages, this is for employers with an average number of 100 or fewer employees. And for our friends on the call who are in for-profits, this is where your business is fully or partially suspended due to government orders limiting commerce, travel, or meetings due to COVID-19. Or where your quarterly gross receipts are less than 50% of your gross receipts in the same quarter last year. Okay, so that's how they would determine the refundable tax credit, the eligibility in the for-profit sector. For our friends on the line who are in nonprofits, this is where your operations are fully or partially suspended due to government orders related to COVID-19. So, we know many nonprofits in this area. That's, one of our industries in DC and Maryland. It's the nonprofit sector, and so they are being hit very, very hard. So, CARES can assist, for those size employers in this regard. So, the qualified wages, what are these? So these are wages that are paid while the employee is not providing services because of COVID-19, where there's, because of the COVID-19 crisis, obviously, or where there's been due to a 50% decline in gross receipts. So think, restaurants or, perhaps, some of the smaller hotels, so many businesses, we don't have the list of the participants here on this call, but I would imagine many of your businesses are tremendously impacted. Could be a government contractor who's had a slowdown. And so this is where the CARES Act, perhaps instead of laying off, again, there's the refundable tax credit for these wages. And so, I'm sorry, and what I just described there, that's for employers with 100 or more employees. Then the qualified wages for smaller employers, these are ones with less than 100 employees. This is where they are paid during the period when operations are fully or partially suspended, or where there's the decline in 50% of the gross receipts. The test of what's called not providing services doesn't apply to employers with 100 or fewer. So the small businesses are provided this amount or this assistance. To the amount of the credit, again, it's 50% of the qualified wages, and it has a ceiling of $10,000 per employee. Louise or Donna, is that a ceiling? Is that in a month?
That's over the period of this, which I believe is in the next 4 months. Is that correct, Louise?
Let's see. It looks, from what I'm seeing, right now it looks like could be between March and December. We're going to have to clarify that because there are a couple of date ranges thrown in there.
And again, these are areas where we're still waiting for more guidance. So some of the legislation is not exactly clear yet. So that's a question we may not get an answer to today.
We can share that information as it's rolling out. And yes, Donna's saying, we are Department of Labor and it's not fully, it's in effect tomorrow, but it's not fully fleshed out. And this is, the credit is taken against the employer's portion of payroll taxes through the Social Security and the Medicare tax. If the credit that you are claiming exceeds the amount of taxes, then the IRS will be refunding the excess.
And if it mirrors what's going to happen with the FFCRA, the IRS did say they would be producing a form for employers to use sometime this week. So we'll be on the lookout for that and sharing it as well as soon as we see that.
Thank you, Donna. So now highlight number 3, the deferral of the payment of the employer's portion of the Social Security tax. The CARES Act allows employers to defer payment of the employer share of Social Security tax on employee wages. So half of the deferred employment tax must be paid by December 31st, 2021, and the other half of the deferred employment tax must be paid by 12/31/2022. So it's allowing you to extend out what you, the employer, owes as far as the Social Security tax. So they're trying to pace out the economic burden here, okay? So that does help many employers. Highlight number 4, there are 4 loan programs available under the CARES Act. The first is the Paycheck Protection Program, which is available for employers with fewer than 500 employees, and that's for both for-profit and nonprofits. The second loan program is the COVID-19 Economic Injury Disaster Loan Program that is also available for employers with fewer than 500 employees. The third program is the mid-sized companies and nonprofits assistance, and this is for employers with 500 to 10,000 employees. And then lastly, there are loan programs available for state and local governments and some special businesses. So we'll share some information briefly about each of these loans, because these loan programs truly are designed to help you keep your doors open and to continue to provide assistance for you to pay your employees. So the Paycheck Protection Program, the eligibility is for employers up to 500 employees with some exceptions. The exceptions about the size, we've provided the link here from the Small Business Administration. You'll have that link that you can check that in your, when you receive the slide deck. Also, hotels, restaurants, and franchises, the employee count is by physical location, not in the aggregate, okay? So if you own one hotel, then you would, again, it's not counted against all the Marriott Corporation, just be on your property. The part-time and agency employees are included in this. So if you are using temp or staffing agency labor, they would be included in your headcount for up to 500 employees. Also, sole proprietors, independent contractors, and certain self-employed individuals may also be eligible. Okay, so those individuals can claim, can apply for Paycheck Protection Assistance. So the amount is 2.5 times the average monthly payroll cost, and that's the payroll cost for the employer. The salaries, wages, commissions, tips, paid leave, severance pay, health insurance premiums, retirement benefits, and state and local payroll taxes. So this is included in your payroll cost. Those particulars are included. So, and it does protect the paychecks up to, for individual employee compensation, up to $100,000 per year. What is not included in calculating your monthly payroll cost is the sick leave or the family leave, for which a payroll tax credit is permitted under FFCRA. So again, Donna will cover that. And why that is not included, because the federal government is already providing payroll incentives for sick leave to protect employees for COVID-19 related illnesses. There is a $10 million per employer cap for the payroll protection. And the use of funds. This is for expenses incurred from February 15, 2020 to June 30th, 2020. So this is a retroactive Paycheck Protection Assistance, okay? That is important because many companies, they were decimated as soon as this happened, within the first week of COVID-19 exploding, in early March. So now, what can these funds be used for? It can be used for payroll, including, again, paid leave, not sick leave, but the payroll, the continued health insurance coverage, mortgage interest, rent, and utilities. And we know that what is so helpful about this is the rent and utilities. We know many organizations, for-profit as well as nonprofits, they can keep in business one or the other, but not both. So this is helping keep the lights on, so to speak. What is not eligible, wages for individuals that exceed $100,000 per year. And we provide the application information down here at the bottom of this slide, okay? So this is the Paycheck Protection Program. So, and again, more information can be found online about this through Small Business Administration. Economic or loan program number 2 is the COVID-19 Economic Injury Disaster Loans. And this is a great program for organizations with less than 500 employees. This provides low interest loans up to $2.5 million. In the interest of time, we're not going to get into detail here, but we've got the eligibility requirements in the application that's available to you here. Loan program number 3, assistance for what's called other organizations. And these are for larger organizations. This is for employers with 500 to 10,000 employees. These have interest rates for the loans capped at 2% and no payments of principal and interest for at least 6 months. There are good faith certifications required, and there are a big impact on employers is the restrictions regarding union activity. So if this particular loan program is of interest to you, you really have to make sure that you pay attention to the restrictions about union organizing during this pandemic. So again, guidance can be provided by your attorney or HR advisors offline about this particular loan program. And then the eligibility for state and local governments, this has the, for those employers, has the requirement not to reduce employment levels by more than 10%. And the special business provision, air carriers, businesses critical to national security, think of our friends in the Fort Meade and NSA corridor, and financial firms. So important to take note there. Oh, sorry, we just covered that on the previous slide, would have been here, but there, again, there is the assistance for state and local governments and the some special businesses provision. So the CARES highlight number 5, the unemployment compensation, the enhanced benefits. The federal government is providing additional monies to the states to enhance the unemployment benefits that are available to employees. So the provision, again, federal assistance, they're increasing the amount of money that employees can claim. The coverage period will be from January 27th, 2020 through December 31st, 2020. There is an extensive and expanded list of qualifying events, about 3 slides worth of eligibility and qualifying requirements. We didn't have time, considering all we have to talk about this morning, to list that. You can find that information, or feel free to reach out to us and we can provide that list of qualifying events. But generally speaking, they are COVID-19 related reasons for, that you have had an employee be qualified for unemployment. There are employees who are not eligible for unemployment. Employees who have the ability to telework with pay, you haven't cut their jobs and they're available to work their 40 hours a week. They are not eligible for, and employers are not allowed to ask employees to collect unemployment and then have them continue to work when they should be being paid by the employer. Also, employees are not eligible for unemployment if they are receiving paid sick leave or other paid benefits under FFCRA. And then the benefits. So typically unemployment, it is deemed the eligibilities by each state, but now the maximum duration under the CARES Act is 39 weeks, which is an increase. This is a combined state and federal amount of unemployment. And it does increase the traditional unemployment benefits, an increase of $600 per week through July 31st, 2020. That is $600 in addition to the $430 per week by state. So 600 plus 430, okay? So that is, again, a very quick overview of the CARES Act. We wanted to do it to provide the resources to you so you know where you can go and what your organization or company may be eligible for. That is one leg of the federal stimulus stool. Donna is going to now provide the second leg of the stool, which is talking about the Families First Coronavirus Response Act, or what's called FFCRA. And these FFCRA deals with the sick leave benefits as it relates to COVID-19. So I am thrilled to turn it over to my colleague, Donna. Donna, you're on mute.
Sorry, trying to be a good presenter and not interrupt. But thank you everyone for joining us today. I'm gonna now walk you through the Family First Coronavirus Response Act. This is a little bit complicated in some places. We have tried to make it as clear as possible. Please, if you could ask your questions specifically, or I should say, your general questions. In your company specific questions, we won't be able to answer today, but be happy to answer any general questions that you have. So starting out, this is for employers, required for employers between 50 and 500 employees. For employers, one number with 1 to 49 employees, you may be exempted at the discretion of the U.S. Secretary of Labor. You can, there is no specific process, there is no specific approval as of right now. The guidance is you should document why your business with fewer than 50 employees, meets the criteria, which is that it would significantly disrupt your business or put your business, stop your business as a going concern. You should not send any materials to the Department of Labor as of yet, but you should keep that material on file. Now, we're going to talk about some reasons why those employers under 50 employees may want to participate in this, even though they are not required to. We'll get into that further as we go along. Would you advance, Amy? Thanks. So, which employers are exempt from the Emergency Family Medical Leave Expansion Act? Healthcare providers, emergency responders, and as we just talked about, potentially small businesses with 1 to 49 employees. Advance, Amy? Okay. Now, what defines 500 employees? And this may not be a concern for most of you. You may fall clearly into that 1 to 400 or 1 to 200. But employers some employers may want their headcount to be fewer than 500 so that they can obtain this assistance from the government to provide their employees with additional paid leave benefits. And so you will want to look on the Department of Labor site, which we do have links to at the end of this presentation. There is now further guidance about how to actually calculate your headcount. And so that is something you may want to consider. So if you are close to that 500 number, you may not want to just dismiss this. You may want to actually take a look to see if your calculations would allow you to participate. So will businesses below 50 employees be exempted for business hardship? This is the exact guidance from the Department of Labor's website. And basically what this is saying is that you should document it if you feel that it will cause your business to cease as a going concern. And so, that's very broad, not a lot of specifics to it. The reality is that the Department of Labor, the Department of Commerce, the Department of the Treasury, they all do want to try to keep as many employees employed as possible. And so that's why these particular laws have been put into place. So as we go through this and you see how the FFCRA, how it pays employers to pay their employees on this type of leave, I think that you will see that it may be of significant benefit to you. Amy? All right. Okay. So this is where we get into things that gets a little bit more complicated. Under FFCRA, what is available to employees and employers? There's two types of paid leave available to employees. The first is the emergency paid sick leave. Some of you have been seeing it as the ESL, emergency sick leave, and that falls under the Fair Labor Standards Act. The other is the EPL, the emergency paid leave, which is under the Family Medical Leave Act. Those types are available April 1st and end on December 31st, 2020. Okay, so this comes up a bit, and we wanted to just cover this because it does apply to both types of leave, and that's if you have variable hour employees. And so if your employees do not work a set schedule each week, they're not, roughly 10 hours a week, 20 hours a week, 15 hours a week. If they're variable hours, you're going to want to look back over the last 6-month period on 6 months from the date in which the employee takes the leave. So if they're beginning the leave on April 1st because they've been out already on something that's qualified as this, then you would look back 6 months from April 1. If they don't start until April 15th, you would look back beginning April 15th, back 6 months. You take the average weekly hours that they worked, and that is what you would use to determine the amount of leave that would be available to them. Is you advancing? All right. Now this is brand new, and this is we alluded to this just a bit, but the CARES Act did amend FFCRA to include sick leave for rehired employees. So this is important to understand. So because under some of these new, under some of the CARES Act, you may be bringing back people who you had previously laid off, right? There may be some reasons why you would want to bring them back to work. And so rehired employees, people who had been laid off after 3/1/2020 that are brought back by 6/30/2020 are eligible for sick leave if they worked 30 of the last 60 days prior to the layoff. So if between, what would that be? Between January 1st and March 1st, if they worked 30 of those 60 days, they would be eligible for the sick leave to be reinstated for them. So the reason this is important is that FFCRA talks about the employee has to have been employed for 30 days prior to taking leave, and so this fills in that gap so that employers who were like, I don't know what's happening, I need to lay off, but that now see that they have payroll assistance are bringing employees back, that those employees still qualify for the sick leave. And this is brand new guidance. Okay. No retaliation. And so this is really just protecting employees, that employers cannot retaliate if employees take this leave. Employers that fail to provide or fail to pay this required sick leave will be treated as a failure to pay minimum wages in violation of FLSA. And that is not something that you want to do. So you want to be very careful to make sure that you're following this very closely and appropriately. Okay. Pardon me, just one moment. I apologize. Allergies are starting to get me this week. All right. So now we're going to jump right into the Emergency Paid Sick Leave Act. This is where employers are required to provide up to 80 hours of fully paid sick leave to full-time employees, and a prorated amount to your part-time employees. Current guidance, we talked about for variable employees, so you would just determine over the last 6 months, or if they haven't been employed 6 months, then roughly what you expected them to work when they were hired. This is in addition to other existing paid leave programs. So if you are saying, oh, I've already got PTO, they're covered, we give more than that, that's not the case. This is in addition to your paid sick leave, your Maryland sick and safe leave, your PTO, your vacation. And there are 6 very specific reasons why an employee, or what would make an employee eligible to use this emergency paid sick leave pay. We're going to go into that next. Okay, and we broke these up into two different categories because there are two very specific reasons why employees can use them and how they're paid for the use of this leave. The first three reasons: the employee is subject to federal, state, or local quarantine or isolation order related to COVID-19. The employee has been advised by a healthcare provider to self-quarantine. The employee is experiencing symptoms of COVID-19 and seeking medical diagnosis. What I want you to notice about all three of these reasons is that they are all specific to the employee. The employee is subject to a federal, state, or local quarantine. The employee has been advised to self-quarantine. The employee is experiencing symptoms. So all of these are very employee-centric. Under these three reasons, they are paid at 100% of their rate to a maximum of $511 per day for up to 10 days. So the aggregate for this would be, the total exposure would be $5,110. Okay? So this is very specific to the employee situation, the employee's health and wellness. The next three reasons 4, 5, and 6, the employee is caring for an individual who might be subject to one or two above. The employee is caring for his or her child if school or place of care has been closed. The employee is experiencing any other substantially similar conditions specified by the Secretary of Health and Human Services in consultation with the Secretary of Treasury and Secretary of Labor. We're still waiting for guidance on that one. We're not really sure exactly what that means. We think that they put that in place as a catch-all in case something else happens that we have no way of knowing would happen just yet. So
if I may step in for a second, number 6, the federal government is trying to minimize the economic impact of employers. And so that's why they're supplementing. They would rather be, quote unquote, safe than sorry. So the idea is if an employee is, again, taking care of him or herself or a family member, covered family member, then, we're trying to deal with the good of the community here. So it's a substantially similar condition. As an employer, go with grace with your employees. The federal government is going to step in, have your back to help you pay for employees with these related conditions. We're trying to keep people out of circulation as we're trying to flatten the curve. So that's why 6 is in play. They're trying to provide the economic stimulus to the employers to keep paying people rather than to say, like, we're done, we can't pay anymore. Right. They're helping you pay people to keep them out of circulation. Okay?
Right.
So go with grace.
And not only that, but also they want, as much as they're trying to keep employees employed to help speed recovery as well, so that you have people in place that you don't have to go and find people again or bring people back. So really, that's if you're kind of looking at this through that lens, then I think it helps make a lot of this make more sense. So each of these three reasons 4, 5, and 6, the employee is eligible for 2/3 of their regular rate of pay, or at least minimum wage, whichever is greater, to a maximum of $200 per day, or $2,000 in aggregate. So this is for 10 days, 80 hours, 10 days, and that's the maximum that they would be paid for this. Okay. Now, what if the employee has other paid leave available? So someone is out because of one of those 6 reasons, and they have other leave available. Beginning April 1, tomorrow, an employer cannot require an employee to use other types of paid leave, sick leave, vacation, PTO, anything else, provided by the employer before the employee uses the emergency paid sick leave. This is an advantage to you as an employer because you're going to be reimbursed by the federal government for paying the emergency paid sick leave under FFCRA. You will not be reimbursed if they use their other leave. So this allows the employee to keep their other sick bank or vacation bank available to them. And also this allows you to be reimbursed for this pay to these employees. Next. Okay, now we're going to dig into the Emergency Family Medical Leave Expansion Act. And I've been calling this FMLA expansion. So if you hear me saying that, this is what I'm referring to. This first piece, there are actually two pieces to this. And so it's important to grasp all of this. The first piece covers all employees, regardless of their tenure or classification. So this would mean anyone that is full-time, that is part-time, that is temporary, that is an intern, anything you've classified them, everyone who's on your payroll is eligible. Okay, and this is the 2 weeks of up to 80 hours of the paid sick leave, which we just talked about, but it is also covered under the Emergency Family Medical Leave Act. They're paid at 100% of the employee's regular rate of pay, where reasons 1 through 3 are in play. Okay, we talked about them a minute ago. The employee has been quarantined by the government, some governmental agency. The employee has been told to self-quarantine by a healthcare provider, or the employee is exhibiting symptoms and getting medical care and/or medical diagnosis. The second piece to this is the or 2 weeks up to 80 hours of paid sick leave at 2/3 of the employee's regular rate of pay for reasons 4 through 6. And then again, this is because they're caring for someone who has been quarantined, caring for a child who no longer has school or child care available, or is exhibiting or has that other substantially similar conditions. So this is the first piece of the expanded FMLA. Okay, so it's being paid for by the paid sick leave. They're overlapping at this point. Okay, next. The next piece is a big and covers all employees who have been employed for at least 30 days. And this is, again, where we go back to that rehire piece. Okay, so if somewhere after March 1st, I did a layoff and I'm bringing these employees back, as long as they worked 30 days between January 1 and March 1, then they would qualify to have this reinstated. Up to an additional 10 weeks of paid expanded family medical leave at no less than 2/3 the employee's rate of pay, where an employee is unable to work due to a bona fide need to care for a child whose school or child care provider is closed. Okay, so this expanded FMLA is only for the care of a child that school is closed or daycare is closed, or their child care provider is not available because of COVID-19. Okay, so and what
and this would be where this would be where an employee is claiming it, like, I just cannot work at all. A lot of employees we're finding they're able to cobble their work together, but their workday might be a whole lot longer. It might be in 2-hour chunks here and there, but they get the job done. Then they're not wouldn't be claiming it. But this would be for employees who just simply would not be able to do it and to accommodate themselves, presumably in a telework situation, or employees that where your business operations have been shut down because of this.
Right. Okay. So 2 points of clarification there. This leave, this and only this leave, can be taken intermittently. So if, let's just say one of your employees has a newborn or a toddler, and we know how hard it can be to try to work when there's a toddler in the room. And so maybe the spouse is able to, maybe you're doing every other day. So dad works one day, mom works the other, or maybe mom or dad is only able to work mornings, and so whatever works, but that is allowed as well under this act. So for those hours that they are not able to work because they need to provide childcare, they would be paid at 2/3 rate. There was something else I was going to say there, and I lost it, so it'll come back to me. Okay, so I'm just going to put this in a little bit different, saying the same things here. Don't think this is different. This is the same, but I found that through doing this webinar that people needed to see it in a couple different ways. So the expanded FMLA is providing unpaid leave for the first 10 days. Eligible employees can use the emergency paid sick leave during this period, or they can use other accrued leave. Employers can't require them to use other paid leave during that first 10 days. You certainly want to encourage them to use that emergency paid sick leave if they're eligible. And only emergency paid sick leave can be required to be used. Right, so you can require them to use that leave. You can't require them to use other types of leave. After the first 10 days, the employee receives 2/3 of their regular rate of pay for the remaining 10 weeks, only if they're using it to care for their child who no longer has school or daycare available. The pay does not exceed $200 per day or $10,000 in total per employee. That's for that 10-week portion. So in total, if someone's home caring for their child, the maximum exposure would be $12,000 in total per employee, right? So that would be a total of 12 weeks, $200 a day. Okay. All right.
Oh, sorry, hold on, let me go back.
That's okay.
There we go, another
okay.
way.
Again, yeah. So this is, if you were kind of looking at this in whole, if the first two weeks, an employee had to be out for one of the other first 3 reasons, they would receive $511 per day to a total of $5,110 for 4 through 6, up to $200 per day at $2,000 in total. The emergency FMLA does not have any paid leave associated with it the first 10 days. Where that comes into play is on weeks 3 through 12, and that would be, they would pay at 66, they would pay at 2/3 rate up to 200, only for child care reasons. Okay. I know it's a little confusing. Hopefully everybody got all that. Okay, now we need a little disclaimer here. We are not tax professionals. I'm not a CPA by training. I like to joke that I worked with enough of them that some of it rubs off, but I'm not qualified professionally that way. However, I am extremely experienced in the way that payroll systems work. I've set up many payroll systems. Payroll has been part of my life probably for 15 of the 25 years that I've been working in HR. And so this is just some information I wanted to make sure that you had, so that those of you that are either required to or who are not required to, but who plan to participate in this, have some sense of, okay, what do I need to do? What needs to happen next? And so first of all, we have a link to the DOL government, their press release about this, that you may find that helpful. But the first thing you need to do is you need to make sure that you're tracking these 2 different kinds of leave, these FFCRA leaves, in your payroll system, so that you know how much I have paid out to my employees under emergency sick leave, and how much I've paid out under the emergency FMLA leave, because you need to know that in order to be able to reduce your payroll tax exposure, so that you can be reimbursed. Okay. So each pay period, you're going to want to determine, and when I say you, this could be your payroll provider. This is a conversation you need to be having with them about how are they setting themselves up, how are they setting you up, so that you can make sure you're getting you're taking advantage of this. Each pay period, determine the total dollars paid to employees under FFCRA leave and the health insurance costs for those employees. That's an important thing to remember, that this not only includes the actual money you pay to the employees, but also their health insurance costs. That is a big advantage for employers. So this isn't the employee portion, this is the employer portion. You subtract that amount from your federal payroll tax liability for that period. Your federal payroll tax liability for this act includes employee federal tax withholding, employee Social Security and Medicare withholding, and employer Social Security and Medicare liability. Amy, if you'll go to the next slide. So I wanted to give you an example of what this might look like, okay? And I know it's a little bit tax heavy, but I just wanted to kind of give you a sense. So if your total payroll, let's just say you're a smallish organization and it's $10,000. This total payroll includes everything you pay to your employees, your employer portion of Social Security and Medicare, your entire liability. Maybe it also includes your SUTA and SUTA and everything else. So everything's included, total payroll. Your federal taxes withheld from your employees was $1,000. Your employer and employee FICA, which if you're not familiar with FICA is Social Security and Medicare. That was $1,000 as well. You paid out $1,600 in FFCRA leave that pay period. The health insurance costs for that pay period for those employees that were covered under FFCRA leave that period was $400. In this case, you would be eligible for a $2,000 credit, correct? Because you've got $1,600 in leave that you paid out, and the health insurance cost was $400. That's a total of $2,000. In this case, you would not remit any federal tax withholdings or employee FICA for this pay period, reducing your payroll cost by $2,000. This is how the federal government is getting that money directly into your pocket by not taking it out of your pocket. Normally, each pay period, you would pay your total tax liability, usually through your payroll provider. Usually, they would be taking that out for you and then submitting it to the IRS. You're still going to have them telling the federal government what your liability was, but they're going to then be seeing that they're going to be providing the information that you had the FFCRA leave credit and what the health insurance costs were. Okay. If your leave payments, let's just say that your leave payments were $2,000 and the health insurance was $500, and so then you're looking at, you have $500 that you're not getting back that pay period by withholding your taxes that were due or that were to be submitted. You can request reimbursement immediately from the IRS. Now, last I saw, and I have not seen the IRS submit an actual form yet, but they have said that this week they will be producing a form that employers can then complete. It may be an online form. They haven't given us specific guidance, so that they can be reimbursed immediately. Now, I'm not sure how fast immediately will be, but that's what they're telling us. And I think they are working very hard to get money back into businesses and do it as quickly as the federal government can. So we'll see how fast that really is. But we really won't know until people start processing their first payrolls that include April 1st. Okay. This is hard without people asking questions now. Hopefully, if you have questions, you're getting them in, because we definitely want to make sure that there's some clarity there. We wanted to put together a list of business resources that we have found to be very helpful to us as we've been producing this webinar. You are webinar number 5 that we have presented on the Family First Coronavirus Response Act, and then our very first on the CARES Act, because it's so new. But the Small Business Administration is a great resource for you to use. This particular link takes you to the Senate. They actually put out some guidance from about CARES. I think they could get it out more quickly than SBA could. So they've done that. The U.S. Treasury, the Maryland Layoff Aversion Fund. This is again another good resource if you're a small business. You may want to take a look at, because this is another fund that is available to you that may help you prevent some layoffs. Maryland Business Express, other great Maryland-only, Maryland-based loans and grant programs that are available. The Maryland Department of Commerce, actually, they have some great information as well. Maryland Small Business Emergency Relief Grant Fund, the Maryland Emergency Relief Manufacturing Fund, for those of you that are manufacturing. And then there's a link there for specific information about those funds. There's so much out there. And I will also encourage you, we didn't have it on there, but the U.S. Department of Labor has great resources right now. In fact, I keep it up on my second screen all day long, and I just refresh it constantly. Okay, again, we listed out some other resources you may want to visit that has COVID-19 resources on their home screens. Again, these are resources we've been using almost daily to help us navigate this. I do encourage you, be careful when you are reading things that are not directly from a reliable source. There's lots of stuff out there, and so make sure that you're really being careful before you make any big decisions, you're looking at what the source is and making sure that it's someplace that you can trust.
And I would also encourage about looking at your industry association, about membership association about your particular industry. So, for example, Maryland Restaurant Association, National Restaurant Association, or again, whatever your particular area is, look, because there will be very specific guidance for your industry. I think that you'll find helpful. So, thank you, Donna. Gina, you've going to guide us in some questions here from our audience.
Yes, ma'am. And first, I would like to thank Amy, Donna, and Louise for this presentation, especially adding the CARES Act, which, like I said, is a daunting piece of legislation, and really kind of drilling it down for us to get at least, a good start and where to turn. We do have a couple of questions, so I'll go ahead and start with the questions I've received. And make sure that we've hopefully answered them. The first question is by Stephanie Trout, and her question is, if a state issues a stay-at-home order, does it qualify as an essential employee for the EPSL if they are working a 1 week on, 1 week off? Or does the employee individually have to be subject to a federal, state, or local quarantine or isolation order related to COVID? And I know we've kind of touched upon that, Donna, but I just want to make sure that Stephanie feels like it,
Right. The individual has to have received a specific federal, state, or local order to isolate. And so while the governor has issued a stay-at-home order, essential personnel for businesses are able to, with simply by having a letter in their pocket from an employer saying that they're essential personnel. In fact, I want to say it's on Maryland's DLLR, but I could be wrong about where that is. There's a template letter that can be used, and so they would just need to be carrying that with them so that if they were stopped, they could show that. But it does not require them. It would not necessarily make them eligible for the expanded sick or the emergency sick leave.
Great, thank you. We have another question from Chris Reel. I'm not sure if I'm pronouncing his last name correctly. I apologize. Who is a kind of business owner, but pays himself a salary as a W-2 employee. So he is wondering if he is eligible for unemployment benefits as more or less as a freelance independent contractor type of situation.
Amy, do you want me to?
Yeah, go ahead, Donna, and I'll chime in if needed, but go ahead.
So the Maryland and the federal government have both expanded significantly their qualifications of eligibility for unemployment. And so my answer would be that yes, he should, if needed, apply. I cannot guarantee that it would be approved. However, the guidance that we're seeing is that they are considering those claims. So it's not a matter of in the past where if you were a freelancer that you were just absolutely out of luck. So that is something that you should at least, if you're affected in that way, you should at least apply.
And I'll say, I think part of Chris's question is that he is a W-2 and freelances. Is that correct?
I'm not sure.
Okay,
yeah,
Chris,
way.
if you are a W-2, then you would be eligible to apply for the traditional unemployment. Then if you do, again, the expansion, the CARES Act is then providing additional economic protections for independent contractors and gig workers. They've been very, that's why a big impetus of the CARES Act was providing economic protections, for sole proprietors, independent contractors, gig workers, contract workers. So through kind of a patchwork approach. So wherever, for the W-2 piece of your job, apply for the traditional Maryland State Unemployment, and then get guidance from your accountant on applying for the economic assistance regarding being a 1099.
Thank you, ladies. Sorry, your moderator, a little tickle there.
It's just allergies, people. It's just allergies.
I know, right?
I know. So we have another question from Grace Scott, and I think she was kind of typing this during one of the slides about the expansion of the Family Medical Leave Act. So she was asking, does this apply to team members who have been laid off and have to care for a child under 18? If yes, does the employee have to request to use the emergency pay, or are employers expected just to pay it out?
So if your employee was laid off prior to 4/1, they do not, this legislation or these leaves do not apply to them. So if the employee has been laid off, you do not need to pay this. Now, if you determine because of these other acts, so the payroll protection program or any others, that you're going to bring them back on staff because it benefits you to do that, then yes, she would be eligible to then use that leave. I know it's complicated, but that's the answer.
So I guess basically what you're saying, because they were previously laid off, it's kind of, it's not available, basically.
Correct.
Because they're not a current employee.
Right. And the other piece of this is that there has to be work available for the employee. So for instance, if I'm in a situation where there's no work and I've laid off my employees, and I'm not going to participate in the payroll protection program, I'm not going to use, nothing else with CARES work, I don't have any work for my employees to do, then none of this leave applies to any of those employees, because there has to be work available for them to do that they're not able to do because of one of those 6 reasons.
Great.
Does that make sense?
I'm scrolling through questions, sorry.
That's okay. I just want to make sure that's kind of clear.
Hopefully, I'll see if I get a note here.
Yeah. Okay.
In the meantime, we have another question. This one's interesting, from Lisa Bird. Hi, just to confirm, I have a friend who works for a national sports team. He works year round. He was laid off and told he needs to use all of his sick and vacation leave before he can apply for unemployment. When we are back and working, will he be able to get his sick leave back under the emergency paid sick leave?
That is not addressed. It's not addressed in the Act, and because there are no federal or state laws, well, there are no federal laws that require an employer to pay vacation and or sick leave, then the answer would be no from the federal side. On the Maryland side, if they're a Maryland employee, then they would need to be reinstated their sick and safe leave that had not been used. But if they're saying that they have to use all that leave beforehand, they would have a zero balance, so they would begin, I would think, accruing it prior, or accruing it when they come back. That's an unusual thing. Most, and in fact, if I were advising that friend, I'd say apply for unemployment now anyway. They'll then figure out when he actually could begin collecting based on the payments that are coming to him.
And employers should not be going at this ad hoc. Follow the payout. If you are laying someone off, pay out the unused and earned leave according to your employment handbook.
Yeah.
If you do not have a policy in the state of Maryland around the payout of unused leave upon termination, as far as it relates to, then for vacation or paid time off, a PTO bank, then the employee is eligible to receive the payout. So follow your policies of your handbook and not just making things up now. Trust the process. If you do not have a handbook, put that on your list of things to do once we get outside of the pandemic.
Yeah. Top of the list.
Yes.
Top of the list. Top
and
of the
that
list.
person,
Um,
I'm sorry, and that person, yes, is in Maryland. Lisa just so. We have another question, and I might be able to actually answer this one. But have you heard how long it takes to get approved for these loans and grants for small businesses? And this is from Stephanie McCartney. Hi, Stephanie. She's a friend. So.
Hi,
Well,
Stephanie. They say they are approving loans quickly. Talk with your attorneys and your accountants. Quickly, we don't, we're not in a position to guide and to give any guarantee as to how quickly this will be approved. They say they say they are going to approve them quickly, but we don't know.
And I guess I'll chime in here just because I was personally on a call with Senator Cardin and Senator Van Hollen prior to the CARES Act being put together and enacted on the SBA loan programs. And at that time, it feels like 10 months ago, but it was probably only a week ago. But they were saying the turnaround for the applications was a couple of weeks, and then between if the loan documents, if the company was eligible, blah blah blah, it was at least 30 days, and before you would probably receive a check. And I know that they have been overwhelmed with applications, so I'm not quite sure if they can really, I'm just being honest, hold to a potential 30-day turnaround. But like I said, that was information probably not quite 10 days ago that I received. So hopefully, Stephanie, that helps to answer your question.
Whether you're the employer applying for the loans or the employee applying for unemployment, do it as soon as possible because every day matters in this. This isn't something to when I get around to it. If this is an impact in your business, it should be done, immediately. Tomorrow is April 1st, so for FFCRA.
Right.
And to make sure that you've checked with your payroll providers, your ADPs, your Paychecks, making sure that they have your payroll system set up to track that FFCRA leave appropriately. That's really important. You don't want to mix things and just say, oh, we'll put it here in this leave, because you have to have the separate payroll accounting for you, the employer, to get the tax refunds and in the remittances correct. So check on these things, please.
Yes, and we have another question from Melinda Haggerty. If our business is considered an essential business, do all of our employees need to carry a letter stating they are essential?
If your employees are essential, if your business is essential and your employees are essential, remember, you can't just blanket say all of your employees are essential. They have to actually be essential. And there are guidelines on the governor's page I've seen about that. So yes, every employee would need to carry that letter, because any of those employees that were stopped need to be able to prove and needs to be on company letterhead. Now, I don't know if they will accept because this is so new, we don't know if they'll accept, oh, well, they've got one on their phone or so forth. But, my guess would be safest bet would for them to have a paper letter in their pocket, in their car, in their purse somewhere.
Agree. I know the partnership is, since we're providing transportation services, et cetera, we have our letter going out to both our vendors and us as employees. So I concur. We have another question from Jerry Gething. For the Paycheck Protection Program, say that fast 3 times, how do businesses prove payroll expenses?
I'm sorry, say that one more
Can you
time.
repeat the question?
Sure. He's asking for that Paycheck Protection Program, how do businesses prove their payroll expenses?
You would, Dada always teaches me this. What you want to do, Jerry, is you want to have a, produce a payroll report from your, most recent payroll period, and that's going to be an evidence of your payroll expenses. Donna, I'm sure Donna wants to expand on that, but that's your first step. You just, again, your historical evidence is your payroll register reports from previous payroll runs.
Right. You can.
I love it when I get a payroll question. Yay me.
Yeah, yes, you're going to want to produce your payroll, your payroll report that is going to show you your total payroll liability. And you should get that if you use a service provider, you should be getting that every pay period. If you don't look at that every pay period, you should be looking at that every pay period, because that's where you find the stuff that goes wrong. And so I'm going to get off my payroll audit soapbox. But yes, that's what you'll want to look at. That's going to give you what your total monthly payroll costs are by pay period. So then you'll need to then take a look at what it looks like from a monthly standpoint. That does not include your benefits, though. Remember that is only going to include wages paid and taxes paid. So you're going to want to make sure you're also looping in the employer cost of the health care and benefits, health insurance premiums. Okay.
Thank you, Jerry, for the question. Thank you, Donna. Gina, do we have any more questions?
I just wanted to pass on. Well, I have one quick question, but I did want to say that Melinda said thanks. This has been great. So thank you, Melinda, for that.
Thank you, Melinda.
Thank you.
And one quick question, I guess I had really quickly, because I was trying to do multitasking here, is that the I guess blah blah blah. It is the FFCRA with if a person. Does that only come into effect if the employee cannot work due to watching, like you said, the baby toddler? So that's if they can't perform their duties, correct?
Correct.
It is, but it also can be intermittent. So it might be that they instead of an 8-hour day, they can only do a 4-hour day because they need to split time with someone else. Or it may be that it may also be that they need flexibility. So, they might not be able to work from 8 to 5, but they can work from, 8 to 10, and then they need to take a break because the baby's back up, whatever it might be. So that flexibility should absolutely be built in.
And then follow-up question to that. So is the maximum amount of weeks paid hourly, you know what I'm saying? Is it 12 weeks or is it 12 plus 10?
No, it's 12 weeks total.
Wow.
And it's only 12 weeks for those that are caring for a child.
Okay.
So it's 2 weeks for the individual, it's 2 weeks for everything else. It's 12 weeks for if they're caring for a child, and that's total. So if I spent 2 weeks where I was caring for myself because I was ill, then I still only have 10 weeks to use to care for a child. If they have, if you got multiple situations coming up.
Because I know with schools, potentially not being back into session, who knows? Yeah.
I'm just gonna put this out there. This could be expanded more.
I know.
If schools are out longer. It wouldn't surprise me if it gets expanded further. So that's a wait and see.
So so for right now it's 12 weeks, and that's the full capability of that program. Okay.
Yep.
Thank you. That was my personal question.
Yeah, absolutely.
It looks like Jerry also said thank you for sharing your time and knowledge this morning. Time well spent. So thank you, Jerry, for that
Good.
Thanks, Jerry.
Thank you. Thank you.
Many other thanks for the others that you answered their questions. They were all saying thank you very much. So with that, it doesn't look like we have any other coming up. So I'd like to thank everybody again this morning for joining us. We hope this was informative. As we iterated in the beginning of the program, these slides will be sent out to those that registered for this webinar. So you'll be receiving those soon. And Amy and Donna's contact information is available on those slides as well. They are fabulous, and we certainly appreciate their time this morning and personally helping the partnership with some of our questions as this unfolds. So again, everyone, have a great day, stay well, and we'll get through it together. So have a great day.
Thank you, Gina. Thank you, Kate. Thank you, everyone, for participating. Have a great day. Bye-bye, everyone.
Thank you. Bye-bye.
Bye. Behind the scenes. Thanks, Kate.
Yeah.
You did a great job behind the
Thanks,
scenes.
Kate. Thanks, Louise. Bye-bye, everyone. Have a
Bye,
great day.
Bye. Thanks.